we studied this actually and published a paper in November of 2021 looking at factors that could potentially predict outcome with daratumumab. And this is a particularly important topic because of the increasing use of daratumumab now in the frontline space for AL amyloidosis and previously in the relapse refractory AL amyloidosis. What we actually found was that, and not surprisingly, an NT-proBNP of more than 8,500 was a poor predictor of response or outcome with daratumumab-based therapy. And we see this also in some of the prospective studies that are being done. There was a study that came out of Colombia and was presented at this conference about cardiac stage 3B patients who were treated with Dara-CyBorD, and we see that their outcomes are not always equal to patients who may have an earlier cardiac stage. We also found that in addition to an NT-proBNP, and this is perhaps the most interesting part of our work, was that GAIN1Q was actually a cytogenetic abnormality that was actually predictive of poor outcome to daratumumab. And there is not a lot of data about how to treat patients based on cytogenetic abnormalities in AL amyloidosis, and so this was a particularly important finding. And then the third thing was the length of daratumumab therapy. So patients who were treated for greater than 12 months actually did better with treatment with daratumumab, and those were the three main factors that we discovered that were important for predicting outcomes in patients treated with daratumumab.